Hey, Margie here. Our hormones and cortisol level play a major role in our bone health. And how do we test for these? Well, that's what we're going to focus on today. And our special guest is Dr. Kim Millman. And Dr. Millman is a Stanford, UCSF, USC trained integrative medicine physician and research scientist. She has been working for 15 years helping women with bone loss discover why their bones are thinning, reverse the root cause, and give them natural strategies to strengthen their bones. She is one of the only doctors that specializes in this integrative approach to bone loss in the country. And she sees patients individually in California and teaches an online program called Restore and Rebuild 100 Days to Healthier Bones. Both Dr. Millman and I have the mission to help women with bone loss go from feeling fragile, frustrated, and frightened to empowered and confident that they can take control of their bone health and continue to do the things that they love. And so today is part 2. If you missed last week's episode, make sure to go back because it was just full of so much incredible information. But this is full of just as much and fabulous nuggets. So I'm excited that she's sharing this webinar with you. So stay tuned. Welcome, Dr. Millman. I'm so excited for part 2 of our testing. It's actually a webinar that you're doing, but all this great information on testing. So welcome back.
Oh, yeah. Thank you so much. This is really something that I think is so valuable to people because it absolutely, these two topics, hormones, including cortisol and stress and sleep, are absolutely so essential to your health. And I see that when people do hormone work, even if it's just a little bit of DHEA or maca, I see people improve so much. And not only do I see their bone turnover markers getting better, but I see their DEXAs improving and they really feel empowered.
That's so good to hear because I hear from all camps. There are people who have been on hormones and have done incredible and it's really protected their bones. There are people who, are big believers in hormones. And then there are people who can't, who've had certain issues. And then there are just people who don't want to go on hormones. But what you're saying is there's all levels. And so just like even the DHEA and maca, which we'll go into that, which is so wonderful. And the cortisol is something, as you know, because I teach the happiness and stress reduction. But what I've found in most of the people, I don't know if you feel the same, I have found people don't realize this piece makes a difference. People are so worried about their food, so worried about, do they do medication? Do they not do medication? And they're so worried about their exact exercise, really, really worried. But they don't think that their stress level and cortisol level is such a big contributor. And what you're here to say, because you've been testing this and seeing. So in your 15 years, what have you've seen, with these things?
Yeah, well, absolutely. So we do some advanced testing to look at cortisol levels, but we can do some simple testing as well. And even just based on symptoms, we can understand that a person has a stressful lifestyle, and then they're anxious, they're not sleeping, they're irritable. And you can just do a little bit of some herbal anti-anxieties like magnolia leaf or some rhodiola or some phosphatidylserine. You can do that at night and really change how a person sleeps, and then do it on and off throughout the day, something like GABA. And it can really change a person's quality of life completely, right? I mean, if people are not sleeping, they're not healing. They're definitely not healing their bones. And if their cortisol is high when they're supposed to be healing, then they're breaking down their bones at this really dramatic pace. And so the other thing that I find is that, the cortisol and stress is also really affects the gut. So if there's a lot of stress, then the person isn't digesting very well. And then this is just a complete vicious cycle that really stress and sleep have to be handled before, well, maybe at the same time as you're doing gut work, because it just won't clear. So it really is a very, holistic framework that, you and I look at. And this is a huge, huge big piece of it.
Yes, I couldn't agree more. And I've seen that through my whole career, just even as a physical therapist. If people are stressed out in the sympathetic state, they just don't heal the same. It really makes such a difference. I'm really excited because you're going to explain this cortisol to people today. And for everybody listening, this is part 2. If you missed the last episode of this podcast, Dr. Millman talked about all the different lab work that she does in her integrative practice and really walked us through why she does it, what value she looks at, and she'll talk about, she really gave out some amazing, interactive lab tests. You'll explain all that afterwards. But anyway, make sure to go back and listen to that because it was just full of so many amazing nuggets that you can put right into your life, and it'll just give you a better understanding of what's involved in this comprehensive approach that's so effective. And Dr. Millman's patients have done amazing, and it's all doable. So that's why, I think it's just so exciting. And I wanted to share, especially this month on osteoporosis awareness and prevention. I'd asked Dr. Millman, can you come this month? Because this is just so valuable. Okay, so I think we're ready to move on, Dr. Millman. We're ready to go to hormones and cortisol, and you can just take it over from here. And I'll butt in when I have a couple things to say.
So today we're going to be discussing the essential lab testing for bone loss. And this is part 2, where we're going to continue to talk about hormones, including cortisol. Just want to remind you that you're in the right place if you're someone with bone loss who wants to identify the root causes of why your bones are thinning, or you're just hoping to improve your overall health because analyzing and addressing the root causes for bone loss will help you to become the healthiest version of yourself. So hormone deficiencies are a major reason for bone loss. And I think it's really important that you get tested to see what your hormone levels are. And you should consider to be tested if you have bone loss or if you have symptoms of low hormones like brain fog, insomnia, hot flashes, achiness, and many more. So it's important to realize that there are many studies that have proven that hormone replacement therapy reduces fracture risk. In the 2000 study, this is the DOPS study, the Danish Osteoporosis Prevention Trial, found that HRT, and at that point, they were analyzing postmenopausal women who had estradiol and progestin treatment, and they had initiated their therapy soon after menopause, and they showed that there was a 39% overall fracture risk, and there was a 76% reduction in forearm fracture. And so this was pretty dramatic, and it's important to note that subsequent studies like the WHI study, the KEEP study, the ELITE study have also confirmed that HRT absolutely reduces fracture risk. I thought it was important to give you a couple of tools that help you to understand whether or not HRT might be contraindicated for you. The National Menopause Society and the Endocrine Society have established that a 5-year risk of breast cancer between 1.6 and 5% is that you would use HRT with caution. And then over a 5% you would avoid HRT altogether. Now, there is a tool that is at the National Cancer Institute breast cancer. It's called the Breast Cancer Assessment Tool, and it is at the National Cancer Institute, and you can find it at bcrisktool.cancer.gov. I'll just show you an example of it. So this is a patient with a 1.8% 5-year risk of breast cancer compared to 2% in the general population. So the tool was asking if the person had a history of breast cancer. The answer was no. A history of BRCA1 or BRCA2, and the answer was unknown. The age was 64, race white. whether there was a breast biopsy with a benign diagnosis ever done, and the answer was no. Age at first menstrual period, 12 to 13. Age at first child, no births, and how many first-degree relatives with breast cancer, and the answer was none. So according to the advisory board, because 1.8% is divided between 1.6% and 5%, the advisory board would say use HRT with caution. And this is something that you can do for yourself. Also, there is a cardiovascular risk tool, and both of those societies have come out and said that women who are at moderate risk for cardiovascular disease, and that's a 10-year risk of having either a heart attack or stroke, that's between 5 and 10%, should use transdermal estradiol therapy. And women who are at high risk, so that would be a 10-year risk that's over 10%, should avoid HRT. So the American Heart Association has a cardiovascular risk tool, and it helps you to identify your 10-year risk of having a cardiovascular event. I have the link on the slide as to where you can get the tool, but this was a person that was, this was a woman who was 64 years old. She was white. Her total cholesterol was 220. Her LDL was 124. HDL was 60. Systolic blood pressure 118, and was on treatment for hypertension. And her 10-year risk of cardiovascular disease is 5.8%. So that puts her at moderate risk. And then both of those advisory boards would say that she could consider transdermal estrogen therapy. So I think it is really important to know what your risks are, your overall risk of therapy, and what the overall risk is of HRT, and then also what your individual risks would be. So that's just a little bit of an insight into how you can go about doing that. So you have a couple of different hormone options. You can measure the hormone in the blood. And so these serum levels, this is the least expensive way to do it. It's good for following hormones, and often your doctors can do it for you. And so there could be insurance coverage, but it's very, very important that if you're a postmenopausal woman, that you get what's called a sensitive estradiol, because the regular estradiol assays are not sensitive enough to show these lower hormone levels. So for example, if the regular estradiol level shows that you're less than 10, we want to know if you're 3 or 6. That's important to us. And also, if you're a woman, you want to get the sensitive testosterone tests as well. You can also do hormone testing in saliva. It's a medium cost point. It is good for baseline testing, but it's not good for following hormones. And I'm going to tell you why that is in a few moments. So the one that I like is the ZRT Female Hormone Panel 3. There are many saliva hormone panels out there, but I like that this particular company has ranges that I actually trust. And the nice thing about the Female Hormone Panel 3 is that it not only has hormone saliva levels, but it also has cortisol levels. And the third option is dried urine. And so this is the most expensive. It's the most comprehensive. It does have cortisol and is good for following hormones. And I'll tell you one reason why it is good for following hormones is that there are 4 urine samples that are taken along the course of the day. And those urine samples they do a weighted average of them. And so this is important because it really represents what a 24-hour kind of hormone level would look like. And so this helps to decrease the variation in the hormones. So let's say that you have an estradiol cream or gel. The hormone levels are really going to vary according to the time in the day. And this helps to smooth that out. So patches are a little bit more a steady state. And so it's not quite as important to do dried urine. And so really what I'm doing is I'll do either a mixture of, I'll do blood or saliva for initials. I really, really do blood almost all the time initially. And then I'll do both blood and dried urine to follow the hormones. So this is an example of a saliva panel that has been done by ZRT. So they have these age-adjusted charts, and you'll see that the estradiol, progesterone, testosterone, and DHEA have been plotted so that the level of the hormone against the age of the person. And there's two red lines that you have a green line that is the optimal level. In between the two red lines, one red line is high, one red line is low. So you get a really very quick graphical snapshot of where your hormone levels are within those ranges. So it's very easy to interpret. And so in this example, I've shown a woman who has low normal estrogen, progesterone, testosterone, and actually low DHEA.
Okay, my question is, because a lot of people are taking DHEA, or a lot of people, as you said, they don't want to take hormones, so they'll just take DHEA. But what's important, like what, in terms of testing, and is that not something that everybody should be on?
It depends. So I'm usually not giving a DHEA if someone's estrogen, and DHEA is the precursor to estrogen and testosterone. And so it can bump up those levels up to a moderate level with just a little bit of DHEA. And I feel like that is one of the safest and the slowest way to, and most conservative way to kind of approach hormones. So if estradiol and testosterone were in low normal, and if DHEA was low normal, or even pretty much low normal, then I would recommend DHEA. So I think it is still important to get a DHEA measured. You wouldn't want to do DHEA if they were in the upper range, for example, or if they were optimal or above. I wouldn't do DHEA. So I still think it's important to be doing this testing.
Yeah, no, I agree, because often too many people, my friend's on DHEA. People hear that it helps and they just take it without the test. And I think that you really brought up a good point. So, thank you.
Yeah, and I think the dosing is really important too. There's a pretty well-known study that showed that fracture risk reduces with DHEA, but they were taking 50 milligrams of DHEA. And that's a really super high dose. It's more of a men's dose. Men's doses are like 25 twice a day, and women's doses are between 5 and 10 milligrams once to twice daily. And I do believe that it still should be monitored.
Okay, great. Thank you. Hey, Margie here. I love sharing resources that can help us address issues we are facing. And unfortunately, we are exposed to over 100,000 toxins every day. Toxins are hiding in the food you eat, the air you breathe, the water you drink, the products you use on your skin and use to clean your home. It's an epidemic underlying so many of our health issues, and something we don't talk about enough. That's why I want to share a podcast I listen to weekly. It's the top 50 highly rated Myers Detox podcast, from one of our former guests and an environmental detox expert, Dr. Wendy Myers. The Myers Detox podcast dives deep into cutting-edge strategies for detox, hormone balance, weight loss, fatigue, and brain fog. If you want to learn how to protect yourself from toxins in your daily life, get to the root cause of your chronic symptoms, transform your skin and hair, and hack your metabolism, as well as releasing old traumas, then I highly recommend tuning into her show. Simply search Myers Detox, MYERS on your preferred podcast platform. Now back to the show.
So dried urine testing. So my favorite dried urine test is through the Dutch company and the Dutch Plus. And so what I like about it is that it's a little bit more comprehensive. And they've got these pretty easy to read little dials. And the dials have a purple band along the bottom, which is the postmenopausal range. And then there is at about 9 o'clock on the dial, there is a gold star, and that starts the premenopausal range. And so you can really quickly identify whether you're in a postmenopausal range or in between the postmenopausal range and the yellow star or the premenopausal range. This is called the gap. So you can identify just where you are. And I like a lot of my hormone targets are in the gap. So I can see just really quickly with a Dutch test if that person is still in the postmenopausal range or if they're in the gap. Sometimes if I'm a little bit more aggressive with hormones, I will go just outside of the yellow star into the premenopausal range, but I never want to go into what's called the mid-luteal range, which is at 12 o'clock. I always want to keep the hormones right above postmenopausal or just right above the yellow star. And that depends on when a person starts their hormones. It depends on whether they are less than 10 years and younger than 60, or they're more than 10 years or older than 60. And the 10 years is that date that they, the number of years since they stopped menstruating. So those are important caveats, and I am very conservative. And so when a person has stopped menstruating quite a long time ago, after 10 years, then I'm using the conservative hormone targets. And when they're younger and it's been less time since menopause, I can be a little bit more aggressive. And I think that is very consistent with the literature and the evidence. So for this particular patient, she was in the postmenopausal range for estradiol and progesterone, and then her testosterone was right at the yellow star. So this is kind of a little nugget that testosterone is one of the last hormones to become deficient in postmenopausal women. And then you can see her DHEA very simply. It's above the yellow star and it's right around 10 o'clock. So this is a person who I did not give DHEA to. So what about cortisol testing? And so we know that cortisol breaks down bones pretty dramatically, and we know that stress is very prevalent. So I believe that everyone with bone loss or who is interested in improving their health should have a cortisol testing done, especially if they're having some symptoms of high cortisol like anxiety and not being able to sleep and irritability, heart racing, and palpitations. So, of course, when stress is high and cortisol is high, we lose bone. Cortisol and steroids impede bone formation. And we know that decades of research has shown that cortisol excess from something like Cushing's disease or those who are taking chronic steroids for inflammatory disease have high levels of bone loss. It's estimated among patients with Cushing's disease that 50 to 59% of the risk of osteoporosis is from high cortisol, and fractures in the spine can actually be the first sign of Cushing's disease. And then the risk of fractures among people taking chronic steroids is double that of people not on these medications. And if a person is on long-term steroids, then their odds of a bone fracture is about 30 to 50%, and that increases with age. long-term doses of even 5 milligrams per day, which is not very much, can decrease the bone formation marker P1NP, which we talked about in the first part, which you absolutely want to hear about the bone markers, which can be reversed after discontinuing the drug. And also, we have data to show that mental stress is a potent contributor to bone loss and increased fracture risk. So they did a study with postmenopausal women with depression, and higher levels of cortisol were related to lower bone mineral density scores at the total lumbar and right femur. And it was estimated that 51 to 67% of the relationship between depression and bone loss was from high cortisol. So we know it is super important. So our cortisol testing options, because of the fact that there is such a large daily change in cortisol, we start out high, and then we at midnight we're at our lowest point. Because of this diurnal variation in cortisol, we want to do multiple checks over the day. So I don't think it's enough to do blood cortisol testing, like an AM cortisol or even a midnight cortisol, to be able to evaluate your pattern. It's much better to do saliva. And we have a couple of different options that I use in my practice. One is, again, the ZRT panel 3, and that was the one that I was using for hormones. It is the least expensive. It's the least comprehensive, but it's the easiest to interpret. And the Dutch Plus also does, the ZRT panel does 4 points, and the Dutch Plus does an extra 5th point. And so the Dutch is the most expensive, the most comprehensive, and it gives you something called a cortisol awakening response. And this is a marker about how well your brain is talking to your adrenals. So this is a curve from a ZRT cortisol. And so just like the ZRT hormones, you have a graphical description of your cortisol level along the y-axis, and along the x-axis is the time of the day. And it's plotted out. And again, you have the green optimal line, and you have the red upper bound, and you have the red lower bound. So in this particular instance, this person's AM cortisol was optimal, and her afternoon cortisol was on the low end of normal. And then the evening cortisol was the same. And then at midnight, her cortisol was high. And so this is one of the reasons why this woman was anxious and wasn't sleeping at night. And so what I did was I gave her some adaptogenic herbs for some support. I gave her some rhodiola in the morning and a Metagenics adaptogenic stress formula called Serenogen, and gave her that throughout the day. And it made a big difference in her sleep. So looking at something called the cortisol awakening response can tell you how well your, it's called the hypothalamic pituitary axis, or the HPA axis. And this is basically the brain talking to the adrenals. So you want that to be healthy. You want your brain to be communicating and being understood by the adrenals, and you want the cortisol to be affecting the brain and its signal to the adrenals. That whole pathway, you want it to be very functionally optimally. And so the CAR, or the cortisol awakening response, is a surrogate measure for how well that is working. So the in the morning, at awakening, there should be a pretty strong increase at the 30-minute awakening point, and then it falls off at the awakening point at 60 minutes. So it is, and you can measure this CAR with a Dutch Plus, and it can give you a really good idea of how your brain and adrenals are talking to each other, and that's important. And just like the ZRT cortisol the cortisol tracings, this also has an afternoon and a nighttime cortisol. And so you can see if there's any times where the cortisol is high, and you can use adaptogenic herbs to help and dampen that, or you can give nourishing adrenal herbs if the cortisol is too low. So what are your testing options? You can order tests through your doctor, and you can order tests by yourself. So we have vetted out some direct-to-consumer testing companies, and I have painstakingly gone through all the tests that I recommend, and I put the test into an interactive testing tool, which I'm going to talk to you about in just a minute. And then I have a testing guide, and the testing guide was developed for my program called Restore and Rebuild 100 Days to Healthier Bones, and that gives you all of the codes necessary to give to your doctor. So this is what it looks like. So you have your lab test, you have your LabCorp and Quest code. And then you have the pre-testing conditions. They're very important, especially we talked about last time, Margie, in part 1 about how the CTX and the P1NPs can be completely inaccurate if you don't do them right. And so in the lab testing guide, we've gone through the pre-test conditions. So you know the code, you know the conditions, so that you get the testing done right the first time, and you don't have to have the stress of delaying the test and delaying your results. And so you can use the interactive testing tool to help you identify the tools that are essential. And then you can take the lab testing guide to give you the right codes and the right conditions. And you can advocate for yourself by asking for these different tests from your doctors. And many doctors will do these tests if you explain why you want them. So you would order the tests yourself through some of these companies that I've vetted out, which include Ulta Labs, Life Extension, Direct Labs, DHEA, and Vibrant America. And within the lab testing guide, all of the codes are there. And so we're not only talking about the basic tests that we just described, but we're also talking about the functional medicine tests that we went over as well for things like food sensitivities and hormones and cortisol and the condition of your gut and your microbiome. So our interactive testing tool, like I said, I'll list the tests that are can be blood and urine tests that you can get from your doctor, or you can order them yourself. And it also gives the real gold in this is not only to know the exact right test to get, but also how do you interpret these tests into what are their optimal ranges. And so you get my optimal ranges. You get to look at your lab tests through the lens of a specialist who's been working for 15 years in the osteoporosis field. And that expertise, I think, is pretty hard to come by. It also tells you whether, if it's optimal or non-optimal, when is a good time to repeat it. And so you can get this interactive testing tool for free if you go to the millmanclinic.com/bones testing.
Before we go on, I just have to say that so often people get labs and they just look for the red, or is it high, is it low, with standard lab values, but oftentimes they're missing it. Am I right, Dr. Millman? Because it's not sensitive enough, and where it may be what they consider, a range it's not the functional range, and it's not the optimal range that you're looking for. So I think this is wonderful that we see what values you look at, and people, they're just not looking at what the red is, or what values are showing abnormal. They can look at this. So this is fabulous. I'm so impressed how you put this together, and it's really a great tool. So I'm excited that you're sharing that with everybody.
Right. And so what people do is they go ahead and they type in their lab value, and then they type in the date of the test. And then what they can do is the testing tool will give them the information about whether they need to retest it or not. And they can compare that to my optimal ranges, which are shown there. And then they can save it as a PDF. And then they can print that out and bring it to their doctor, bring it to their functional medicine doctor. So I have a lot of people now who are actually bringing me my own tools summary, and it keeps it in one nice place, So, and then whenever you want to update it, you can go in and put the new values into the tool and update it. So I think it's really helpful.
Oh, absolutely. And I think, more and more doctors are appreciative. It's not that they don't want the information, it's just not something they've always looked at. So I think it's great. So thank you so much for doing that.
Yeah, and I think this is, especially the case, for the bone turnover markers, because the bone turnover marker range, I can't quite remember them, but I think it's something like for CTX is like 100 to 1,000. And we know that most people are breaking down bone over 350. And so it's like it's a huge difference compared to knowing not all doctors deal with these bone turnover markers. So you really have to have a doctor who's got some experience with it.
Yeah, and that's, as I always say, and I know you do as well, knowledge is power. So that when you have a basic understanding, it makes such a difference when you can be part of your treatment and understand, what really is going on. So I love this. This is great.
Yeah, and this is another thing too, is that if you didn't, if some of what I was talking about is a little overwhelming and maybe it's a little over your head, you have this nice testing tool that kind of summarizes it all for you.
Yeah, that's great. Thanks again for doing that.
Yeah, so I just wanted to tell the listeners about the Restore and Rebuild 100 Days to Healthier Bones program that is going to be starting again in September. And Margie is a co-developer and a co-teacher. So we have 14 live weeks of where 10 weeks of those are have content, and then the other 4 weeks are integration weeks where you can take a breath and kind of review things that you haven't been able to get to, and then we have Q&A sessions all 14 weeks. And there's so many resources that we've got self-assessments and trackers and and I've got protocol generator tools. Really, I mean, if my protocol generator is really, really awesome, and that's in the program. And I have developed the curriculum so that I'm really teaching what I do in my practice every day. And I teach how to interpret each test, what tests to get, and then what are my tried and true protocols for dealing with abnormalities. And then how do you prioritize as well if you've got a few things going on. So this program is going to start in September, and they're going to be Thursdays at 3 p.m. Pacific. And you can join the wait list now. And so you go to themillmanclinic.com/R&R. And then you make sure to use the referral code FALLMARGIE. And Fall is with a big F and Margie is with a big M, because you're going to get a special discount code when we open registration.
Yeah, so I have to say, I don't know how many years ago, Dr. Millman, because the problem is we all want hundreds of you, Dr. Millman. It's very hard to find functional medicine doctors or integrative doctors who have been doing this for a long time and who really specialize in osteoporosis, because there just aren't that many people. I don't really know. I know very few. And so if any other, besides you, I know a few other people, but you really have specialized in this, who are MDs as well. And anyway, so this was sort of a solution. Well, how could you have a group program and still help people with their testing? and you did it. You accomplished this because you've had two. You're already going through. You've done one class. We're already on the second class, and people have gained so much from it. And so I teach two of the classes. Dr. Millman teaches the majority. I teach one on exercise and on stress reduction and happiness. And but I think the most valuable part of the whole program is after each class, after Dr. Millman presents the information, then there's a Q&A, and you really help people with the Q&A, so everybody can sort of, have their own program, and you're giving them advice. It's not patient advice. You're just explaining that, yes, if you had this issue, this is what, I would recommend. And then you can have your own doctor who's not integrative, who is following you, because then you have all the resources of this program. So it's just been I can't even tell you how many people in my community thanked me. And for all the people in my community, this supplements everything we do because it all goes together. But people were just like, thank you so much for introducing them to you and for this program. So it's that good. It really is. And I think you've kept the price reasonable considering how much time and effort and one-on-one people, really get in terms of the questions and ability to ask their questions and figure out, their whole program. So it's just been, it's really been wonderful. So, and I'm so glad that I've been a part of it as well.
Yeah.
So.
And I'm going to say maybe 10 people who I know that their CTX values have gone down since they've been doing the program.
Yeah. I think the beautiful thing about this method is that you're dealing with root causes. You're not just blindly dealing with osteoporosis. You're figuring out what could be your root causes, and they're different for each person. Then when you deal with them, everything gets better. It's, as I always say, I think the diagnosis of osteoporosis is a blessing in disguise, because when you deal with what's the issues with your bones, everything gets better. And you look back and you're like, wow, I'm doing so many great things for my bones and overall health. So anyway, yeah, so it's really good. I think everybody has all the links, and yeah.
And then the last thing to talk about is that if you go over to the site and get an opt-in for the interactive testing tool, then the perfect marriage between the interactive testing tool is this lab testing guide. And honestly, this was developed for the program, and it took me at least 6 weeks to just get all of the right codes and all the right precondition testing situations and put this into one compilation. I think that it's a perfect synergy, because if you don't have the right test, then the interactive tool isn't going to give you the right data. So it's this really synergy between them, and it comes with the program, but there are a certain number of people out there that are not going to take the program, but are still interested in getting all of the codes that they need and everything in one place. Not only is it the codes for the things on the interactive testing guide, but it's also the codes and where to get the functional medicine labs as well. And if a person ends up taking the program, then we're going to give a special discount code for them for $27 off the program. So that won't be an issue. So the link to go there will be the millmanclinic.thrivecart.com/essential-lab-testing-guide. And I know that Margie is going to have all of these links in the show notes for you.
Exactly.
And so I really hope that everyone has been able to find some value in this. I certainly know that my patients really improve when we work on their hormones and cortisol. And like Margie said, I would just harken back to the fact that even if you're not interested in doing bioidentical hormone therapy, there are other things that you can do, like DHEA and maca and boron, and even the cortisol testing. Some of the things that you can do will carry over into the other parts of your life, including maybe to decrease anxiety during the day, or just have you feel like you're a little bit more resilient to stress. So I think that's what the value of today's topic was.
Yes, it's so true. And this is, these tests and this piece of it is just so important. So I really hope I hope this brought that to everybody's attention, because, we want to do everything we can. And how great if you can have less stress and more resilience. And, when that wave comes, because life isn't easy. We all know that. But when that wave comes, guess what? It doesn't throw you over. You're able to ride it. And it's just a different way of living. So I think this is all so fabulous.
Yeah, and some of these, these herbals that I use in my practice, like magnolia leaf and GABA and phosphatidylserine, I mean, they help a lot. I mean, they help a lot.
And so that's so great, because you've seen that. You've seen with people
Yeah.
so you've seen total lives change. I mean, when you're less anxious and when you can handle, just enjoy your day and not be, not. And I think one of the big things is realizing, a lot of people think, oh, that's just the way it is. Life's stressful. But we're here to tell you that it doesn't have to be that way when you address it. So.
And even someone who goes from having 6 hours of sleep to 7 hours of sleep, that can make a big difference.
Really. So good. I think for both of us, just want to share that, it's Awareness and Prevention Month, and so much can be done, and it's so empowering. And I think we can all be empowered to make these changes, one at a time. You don't have to do all of it. And we got this. So I think it's so good. So thank you, Doctor. I always can't thank you enough for the dedication and the unbelievable work you've done. You've taught me so much. I'm always grateful, and I love doing things in conjunction with you, because I think that it's really making a difference for people. And that's what the two of us are all about. So thank you so much for joining me here today, and for the two really, really wonderful webinars you put together on testing. I just think this information's invaluable. So thanks so much.
You're welcome. I was honored to be here.
I hope you enjoyed my interview with Dr. Millman as much as I did, and now have a better understanding of cortisol, hormone testing. All the links that Dr. Millman talked about will be in the show notes. And don't be overwhelmed. You can go back to it as much as you want. The interactive lab tool is really amazing. So that's free. And you can download that and use that, because it will really be helpful when you're looking at your lab values and trying to figure out what might be some of your root causes. And as I said, all the links to the program, the wait list that's starting in September, will be in the show notes. And if you're listening to this another time, Dr. Millman's going to have continual programs. So I'll have the latest updated version, when the next class is, in the show notes. And also make sure to download my handout on exercises for osteoporosis. And I really go into balance and what exercises are so important, posture and some weight bearing. So that's just some more resources you can put into your life as well. So thank you so much for tuning in, and I look forward to seeing you on the next episode.